The next section we'll be discussing are drugs for angina, and angina refers to chest pain that may or may not be a myocardial infarction. Usually it's not. Angina comes about because of a lack of oxygenated blood to the muscles of the heart, and sometimes that can happen without it doing any permanent damage to the heart muscle, as you would see in a myocardial infarction or an MI. So depending on the type of medication it is, they have some different actions. So on page 149 on the table, we see some different categories of drugs, and the most common category of anti-anginals you're going to see is the nitrates. That would include the drug nitroglycerin. These are known as the universal dilators or vasodilators. They work on the smooth muscle of the vascular system, so they're going to cause those muscles to relax, so you're going to have dilation of the arteries and the veins. They work to decrease oxygen use in the myocardium, the muscular areas of the heart, and they increase what we call collateral vessel circulation. The body has a tremendous ability over the years, as it senses a lack of or a decrease in oxygen to certain parts of the heart, to allow the heart to form what are called collateral vessels, or new smaller vessels form to try to make up for the fact that the larger vessels are occluded. And it's believed that the nitrates can kind of help this process. We also see a drug we've seen before, the calcium channel blockers, and we talked about them when we were talking about blood pressure. And they also work to help dilate the coronary arteries and arterioles. If you remember, the calcium goes into the cells and carries messages, and these messages result in artery constriction. And when you block the calcium from getting into those cells, you interrupt those messages, and the arteries don't get the message to constrict, so they stay dilated. So calcium channel blockers dilate coronary arteries, and they also are going to reduce the response of the electrical conduction system. Remember, the heart is not just a physical organ, it's an electrical organ, and messages are carried all through the heart that help it contract. And so if you reduce that response, you're not going to get as big a constriction of the veins and arteries that supply the heart. And we remember, hopefully, that our prototype calcium channel blocker is called verapamil or Calan. Then we have peripheral vasodilators. Let me stop here.